Welcome to today's media call. Let me start over there. Hello, everyone, and welcome to today's media call with the Association for State and Territorial Health Officials. And thank you very, very much for joining us. My name is Marcus Plesha, and I'm the Chief Medical Officer. I'm the Chief Medical Officer at the Association of State and Territorial Health Officials. There are many potential impacts of climate change in today's society.
If I'm plugged in the microphone, why am I not hearing on the microphone and I'm hearing it on Marcus?
I don't know who's speaking, but we can.
Marcus, I'm muting everyone. Just so
okay.
You know. Everyone on the line not speaking, if you could mute yourself, we'd appreciate that. Thanks.
Great. So I was just queuing things up. I was saying that, as we all know in our society, there are many potential impacts of climate change, and it's a very important issue for us. But today, what we're going to focus on is the health impacts of climate change. And these are multiple. They range from things like injuries due to conditions like heat stroke, asthma or exacerbation of asthma, cardiovascular disease, and after long-term exposures, even cancer. Today, we're going to hear from state health officials who will discuss the health effects of climate change in their jurisdictions. And so I'm going to go ahead and introduce the four speakers we have now in the order that they will appear. First up will be Dr. Natasha Bagdasarian, who is the Chief Medical Executive at the Michigan Department of Health and Human Services. Next up after her will be Dr. Joseph Kanter, who's the State Health Officer in the Louisiana Department of Health. After Joseph will be Dr. Mark Levine, Commissioner of Health in the Vermont Department of Health. And then following Mark will be Dr. Umair Shah, Secretary of Health at the Washington State Department of Health. So with that said, I'm going to turn this over to Dr. Bagdasarian to make her remarks.
Thank you so much. I wanted to say a few things about Michigan as it relates to climate change. Michigan has often been labeled a climate haven with mild temperatures and access to plenty of fresh water from the Great Lakes, which hold over 80% of North America's surface freshwater. But it's important to remember that even states like Michigan are not immune to the effects of climate change. I want to just say a few things about air quality and flooding as it relates to the Great Lakes. It pains me not to talk about infectious diseases because I am an infectious disease physician, but I'm going to try to limit my remarks. First, talking about air quality. Many states have dealt with air quality issues for decades. However, air quality alerts are something very new for Michigan. Just this year, a historically bad wildfire season in Canada led to Michigan experiencing unprecedented air quality impacts, requiring us to rapidly develop messaging for communities that were not used to hearing about air quality risks. This past summer, Michigan issued the first ever AQI alert for PM 2.5, and there were multiple days in June where AQI reached hazardous levels across the state. We also had several days across the Midwest with higher than expected asthma-associated emergency department visits. And we, of course, expect this trend to continue as climate change increases the risk of wildfires. A few words about flooding. Annual precipitation in Michigan has increased by 15% since 1950, but more importantly, patterns of precipitation have changed, and we are seeing more heavy rainfall events. Much of our infrastructure was not designed for this type of heavy rainfall, which has contributed to reoccurring major flooding in many communities. We've seen dam failures and other drainage failures. Now, in Michigan, over 2 million people use private wells, and flooding poses unique dangers to their drinking water. Now, just a couple of words about the Great Lakes as we talk about flooding and other climate change impacts. The Great Lakes are the largest surface freshwater ecosystem and contain 20% of surface freshwater on the planet. More than 35 million people in 8 states and Canada depend on the lakes for their drinking water. This water is warming, which is concerning for freshwater ecosystems, and increased rain runoff from farms can contribute to things like algal blooms. So we are working to protect the integrity of the Great Lakes ecosystems from the threat of climate change. This means working with regulatory agency, and we also need to help the public understand the connection between climate change, drinking water, and the food we eat. So things we are doing right now, I'm pleased to say there's a lot of great work happening across the state on all of these fronts. We're developing new predictive tools for things like air quality. We've developed rapid communication tools for climate events, including air quality and flooding emergencies. We're working on collaborative partnerships with federal and local agencies on coordinated response to the impacts, and we're developing tools for building long-term climate resilience. But I want to conclude by saying that climate change is a risk multiplier. It exacerbates existing health and social inequities, and we must think about the most vulnerable communities in each state and involve those communities as we go about our planning and our response. Thank you.
Thanks, Dr. Bagdasarian. This is Joe Kanter. I'm the state health officer in Louisiana. And I appreciate the comments about this being a risk multiplier, particularly for disadvantaged and marginalized communities. We've certainly seen that in Louisiana. It's been a very strange and challenging few months in Louisiana in dealing with weather-related complications, and not for the reasons that we typically see this time of year. We're still in hurricane season in Louisiana. We dealt with historic wildfires across the majority of the western part of our state at a level we have never seen before, causing relocations and evacuations for a number of communities. Over the past 3 weeks, we've been dealing with the threat of saltwater intrusion coming retrograde up the Mississippi River, threatening the potable water supply for communities in and around New Orleans. So from New Orleans on south, communities draw their drinking water from the Mississippi River. The Army Corps of Engineers maintains that river, and since the 80s has been involved in successive dredging efforts to deepen the shipping channel. Those dredging efforts combined with historic drought conditions, as Dr. Bagdasarian mentioned, in much of the country, particularly the Ohio River Valley that drains into the Mississippi River, have created a situation where the flow of water in the Mississippi River is insufficient to keep salt water from the Gulf of Mexico from intruding upriver. That is happening now, and there's a saltwater wedge coming northward, retrograde up the Mississippi River, that is threatening the water supply for a population of about 1 million people in and around New Orleans and in communities on south. These drinking water systems purify water and take out contaminants, but are not able to take out salt to the level that this threat presents. We are comforted because as each week has gone on, the Army Corps of Engineers has refined their projections of how far this saltwater wedge will make it up the river and when it will do so. And the latest projections show that the bulk of the population areas around New Orleans and surrounding suburbs are likely to be spared. And that's really good news and fairly recent news for us. But there remains communities in Plaquemines and St. Bernard parishes that are still at risk and also currently being inundated. Those communities are providing bottled water to the residents right now. They're using barged water coming down the river and large reverse osmosis machines to help remove the salt. Those are solutions that are applicable in those smaller communities, but would not have been applicable, would not have been possible solutions had this saltwater wedge reached New Orleans, where the large population is. And I'll tell you, providing bottled water would have been the easiest of the responses that we would have had to face. The larger concern would have been widespread corrosion in the water distribution system in the pipes and the potential for leaching of heavy metals, particularly lead, into the water supply for some time to come. All this to say, this presents an extreme risk, and we are expecting that the risk will not be limited to this year as we experience more unpredictable weather and certainly more droughts in the future. We can expect this risk to return. Our department, the Department of Health, works closely with water systems to help mitigate and help test, assuring communities that water is safe to drink. But we will need help preparing to mitigate a threat like this going forward. We're thankful that the larger population areas around New Orleans are likely to be spared this time around. This buys us some time to hopefully institute and build more permanent mitigation solutions. There are options on the table. A pipeline upriver to draw water from above where such a saltwater ledge is expected to reach is probably the most viable option right now. We have some time to figure out the best solution in partnership with federal agencies. And we hope that we take this opportunity to make investments now, knowing that this will not be the last time that we experience a threat like this. I appreciate the opportunity to talk about this, and I'm going to hand it over to Dr. Mark Levine from the great state of Vermont.
Thank you very much, and greetings from Vermont. As you know, we've been known for our harsh winters in Vermont, but with the dramatic escalation of heat events across the country in recent years, we've begun to see a new phenomenon, that of the climate refugee arriving in our state. Limited in numbers only by the crisis in housing our state has experienced. My comments in these next few minutes will lead you through the past year, providing a fresh look at climate extremes and at times the devastating consequences, and I'll also speak a little bit about funding. In public health and in state emergency response, Vermont has been in a continuous disaster response cycle over the past year. Starting in December of last year, we had windstorms with widespread 60 to 70 mile per hour gusts, which caused millions in damage due to power disruption, infrastructure damage, and debris removal, culminating in a federal disaster declaration. In February, when we're accustomed to extreme cold, we had wind chills as low as minus 50 degrees. Yet in April, we had the hottest April on record for our state, with multiple heat-related emergency department visits. That was only trumped by mid-May, when a killing frost caused tremendous damage to crops and vineyards, losing about 50% of the apple crop, and a USDA disaster declaration. When our pandemic general assistance motel housing program ended at the end of May, it coincided with an early June heat wave, causing multiple heat-related emergency department visits. Throughout June and in early July, we had moderate drought, abnormally high wildfire risk, and times when the air quality index reached the unhealthy or red level due to wildfire smoke from Canada. We had another heat wave around 4th of July week, which caused innumerable heat-related emergency department visits. And then the peak event of the year started around July 10th, where we had a prolonged stationary front and severe rain event leading to flooding, with ongoing flash floods, landslides in many locations. This caused eventually 2 deaths, multiple disabilities, widespread impacts on homes, on businesses, farms, the entire road infrastructure and bridge infrastructure in the state, followed by mold issues and issues with well and spring water contamination with bacteria. As if all this isn't bad enough, there were days where we actually were telling people to do some of the mitigation from the flooding and get outside and work on things because of mold inside, yet air quality was poor enough that they shouldn't be outside. Very conflicting health messages. It's really challenging to respond to so many types of disasters using our traditional public health tools, surveillance, outreach, interviews, other response activities. Really challenges our bandwidth and our ability to move from a constant response mood to preparedness mode is where we'd love to be, yet it seems that there's a new disaster around the corner related to climate each time. Public health has had little time or funding support for education, preparedness, evaluation, addressing the fundamental issues of environmental justice and health equity that you just started to hear about. And certainly there's a substantial mental and emotional toll of climate change, especially on the heels of a prolonged pandemic. Now, a few words on the status of funding dedicated to fighting climate change. Historic federal investments occurred in 2023. President Biden's infrastructure law and the Inflation Reduction Act together invest many more than $50 billion in climate resilience and adaptation. In fact, the Inflation Reduction Act is the largest ever investment in clean energy transition. Much of its firepower goes to transportation and electricity generation through tax incentives or credits, as well as loan guarantees. But there's also a host of initiatives for upgrading infrastructure, funding carbon capture plants, and protecting the health of historically disadvantaged communities through attending to environmental justice priorities. But I emphasize, none of this funding actually is earmarked for health departments. The only direct federal climate funding that supports public health and state health agencies is the CDC's Climate and Health Program, which has been a level-funded $10 million per year program for many years. Vermont has enjoyed this very modest amount of support since Tropical Storm Irene in 2012. It helped us develop the Vermont Climate and Health Program, which now funds exactly 1.3 FTEs, which is around 0.1 to 0.2% of our entire department. Now, for the last 2 years, the president's budget has called for $110 million in funding for the CDC's program, which would be an increase of $100 million over fiscal year 2022 and 2023. Now, considering that Congress has level funded this program for many years, and yet the president's budget proposed an increase, this certainly may signal a potential misunderstanding of the role of public health in preventing and responding to climate change. I'll now turn the comments over to my colleague from Washington, Dr. Shah.
Thank you, Dr. Levine. Thank you, Mark and Joe and Natasha and Marcus for the opportunity to both listen to your comments and also to play cleanup hitter here for what is such a critical issue for all of us. And I want to maybe start by not duplicating what my colleagues have so eloquently said, but also recognizing that Washington State also remains very much a part of the ecosystem of health and well-being and the protections that are needed for our communities. But we also recognize that our communities change and transition and are transient over time. And so what happens in one part of the country or another part of the globe has absolute impact to Washingtonians and vice versa. There is a bidirectional connection for all of us as state health officials, and we need to continue to recognize that. I'm proud to be a part of an administration under Governor Inslee that prides itself and has focused on climate, the investments that are necessary in climate change. And as part of his state of the state earlier this year, he recognized the importance of landmark policies that are very much about transitioning us to clean transportation, clean electricity, clean buildings, and also clean fuel standards. And that really very much is about policies, but also shifting to both implementation and investment, which I think is the key message that all of my colleagues are saying, is that these are not just about policies, but we have to make sure that we're appropriately investing in the health consequences of climate. Climate change is real. Climate change is here. Climate change is happening before our eyes. As you've heard from my colleagues, similar in Washington State, we have had, unfortunately, in the Pacific Northwest, concerns around heat that we have never seen, triple-digit heat in the Seattle area, in eastern Washington, just south of us in Portland as well, where we have now 2 or 3 years running of triple-digit heat that continues to impact our populations. But we're also seeing the ramifications of smoke and wildfires and the real challenges that come through with respect to those issues, as well as flooding. And flooding in the midst of the challenges challenges that we've had. Obviously, I was previously in Texas, and Joe and I can commiserate and share a lot of concerns related to hurricanes. But I will tell you, when we talk about atmospheric rivers in the Pacific Northwest, it puts a different spin on what the concerns are related to flooding and climate-related challenges. The other pieces that are very much about what both Mark and Natasha talked about related to infectious diseases and vectors and the changing vector climate that really ultimately is the concern that we have for illnesses that we have not seen in parts of the country or the globe because of the changing climate, that also climate change has a significant part to play. So one of the things that in the state of Washington that occurred a couple of years back in 2021 was the passage of the Climate Commitment Act, the CCA, which was very much about looking at capping and investing in the investments in transportation, as well as the transformation of the way we were looking at all of the different challenges that we have, from heat pumps for low-income families, charging stations for electric vehicles across the state, hybrid electric ferries, free transit for youth, grants to clean up air pollution, and the list goes on. There were about $1.7 billion that were invested previously in this realm. And I'm proud to say, as our legislature just passed its budget, we saw historic investments again in the Climate Commitment Act and the natural resources concerns for $400 million in Climate Commitment Act investments, $45 million for forest, heat, health, and wildfire protection, $40 million approximately for biodiversity protection, and $36 million for salmon habitat and recovery. And you may be asking, well, where does health come into this? Our department also received over $26 million to support our efforts for climate change. And some of those efforts are very much about not just protecting people from the seriousness and the frequency of health problems that people already face related to climate change, but creating new or unanticipated pathways to solve the problems that are really challenging ourselves to be better and to think about tomorrow. And I'm reminded of our tribes. We have 29 federally recognized tribes in the state of Washington, and they have this notion of 7 generations, that they look back to 7 generations prior, what our elders, our history has taught us, and what we do today impacts the 7 generations of children and grandchildren that come after us. And I think that is such a critical way of looking at this. So we've had some incredible partnership and incredible amount of tools related to this. Some of these that I will highlight, Amazon World Services and our climate and health team are focusing on getting public, actionable, precise health data through a single source. This partnership continues to work on 2 projects, one for pollen surveillance and the other around harmful algal blooms that you heard Natasha talk about previously in our waterways. There's also a climate and health team that's working with the University of Washington for a climate health and risk tool that helps decision makers and community members alike understand various environmental hazards. We are, as you can see in my background, recently we launched our transformational plan. And I'm proud to say that environmental health and climate health are part of that transformational plan as one of our 5 priority areas. We also are the first state health agency in the nation to have Global and One Health as part of our transformational priorities as well. And why I want to discuss that is because it's so critical that we remember the interconnectedness of what's happening across the globe to what's happening in our states, and vice versa, as I said earlier, but also the connection of One Health. What happens with humans, animals, and the environment is ever critical to the work that we do. So we know there's a lot of work that lies ahead. We are making historic investments, but we recognize that we're one part of the ecosystem, and it's all of us as a nation, all of us as a globe that need to come together to continue to fight climate change, because climate change is here and it's impacting our communities today. Thank you, and I'll turn it back to Marcus.
Great. Well, thank you very much. And hopefully those of you from the media got a good sense here of the wide range of health impacts of climate change that we're seeing across a number of very different states. In Michigan, which is Dr. Bagdasarian says, not typically a place that you think of as being impacted so much by climate change. She recounted a wide range of issues that they're seeing across their state and really across a wide range of sort of health problems. Dr. Kanter talked about a wide range of things also, but also some very specific threats to water quality, which can have a profound impact on health, and which some of these situations also are likely to be extremely expensive to mitigate. Dr. Levine talked about some of the recent environmental disasters, or focused on some of the environmental disasters they've had recently. Those were very much in the media, and our thoughts were with them just recently. And then finally, Dr. Shah talked about something we think about in the West, which is smoke and wildfires, but also something we don't think about, which is triple-digit, heat temperatures. And also, several of the speakers brought up something I think we often don't think about, that climate change has health impacts on sort of typical things like injuries and asthma, but also can really contribute to an uptick in infectious diseases, because, as Dr. Shah referred to, the whole interface of One Health and the fact that our environments and other animals in our environments and ourselves are impacted by any of these kinds of changes. So with that said, we're going to go ahead and open things up and let you ask specific questions of our speakers.
If press just want to use the raise your hand feature to ask a question, and we'll try to go in order from the questions we receive. So we'll welcome questions at this point. Not seeing any yet. Don't be shy if you have questions. All right, I'm gonna unmute Joyce. Joyce, you're unmuted if you want to introduce yourself and ask your question. Thanks.
Sure. Thanks. Joyce Frieden from MedPage Today. I want to ask Mark Levine. He mentioned that the CDC climate program, he talked about considering that Congress has level funded this program for many years, and yet the president's budget proposing an increase may represent a misunderstanding of the role of public health in dealing with climate change. I just wanted to ask you to clarify that. I assume you mean that Congress doesn't understand it because they've been flat funding it, but I wanted to get some clarity.
Yeah, I think you're interpreting my comments correctly. I think it's important to provide the context here. If you ask the World Health Organization, what is the single biggest health threat facing humanity? It is climate change. If you ask all of the professional organizations across healthcare and medicine what the greatest public health challenge of the 21st century is, they say climate change. In 2021, the editors of 200 medical journals basically all said that a global temperature increase of just 1.5 degrees is the greatest threat to global public health. So people need to hear that message from those who are most expert in delivering it, and resonate with the thought that not only does climate change need to be much better funded in general, but the public health threats to climate change are real and they're upon us now. And I think we've all kind of talked about them, but certainly the health impacts in Vermont that we've put at the top of the list include the very obvious, like heat-related illness, and the secondary impacts from storms and flooding and these extreme weather events. But we also want to mention vector-borne diseases, both by mosquitoes and ticks, the blooms of cyanobacteria, the blue-green algae blooms that have plagued us to a greater degree than ever this past summer, water and foodborne diseases, and then finally, as you heard, the air quality impacts and the impact on respiratory disease. And that doesn't even begin to get into all the impacts on chronic disease and mental health and other issues that we've mentioned here.
Stephanie, I don't see that. If you see Aaron Durkin has a question, if you want.
Yes, I was trying to unmute. There she goes. Erin, you're unmuted. Go ahead with your
I just
question.
didn't want to interrupt. Thank you so much for holding this. And just along that same vein, you know, along with maybe more funding in the CDC program, I'm also just curious if there are specific asks from Congress and the administration that you all have. I mean, obviously during COVID, we saw, you know, how, you know, stretched to the limit many public health departments were. And now there's also concern that there's going to be disinvestment after that public health emergency. And so as we go forward, and as you're concerned about climate change, and especially because each area seems to have sometimes unique needs, you know, what do you need from the federal government at this point to really adequately address these challenges?
If I could jump in for just a moment, and thank you, Aaron, for asking that question. You're right. Dr. Levine made this comment about the importance of funding CDC and making sure that our federal partners have the resources that they need in order to be able to get those dollars out to other entities. And I think we forget that when we fund the CDC, that it's not just funding an organization, but many of those dollars then go to state health agencies like ours. They go to local health agencies, and they ultimately are impacting the communities, the very communities that the elected officials have constituents in. And so I think it's such a critical piece to remember the connection all the way down from federal, state, local to community. The other piece is that we do want to make sure that there is this articulation that is so critical, that there have been political divides in so many respects across the system. And we know we saw that during the pandemic. And this is really something that should ultimately be concerning to everyone, that public health and our environment and the communities we live in, or the air that we breathe, or the water that we drink, impacts everybody. We want to make sure that that articulation is there, that we are saying that as loudly as we can, that we are concerned about our climate, we are concerned about our environment, we are concerned about the health impact on people. And we want to make sure that these are not looked at, especially the extreme weather events, as isolated, just happen to happen, and they sort of move to just a couple of dots here or there. My favorite saying is that we're very good at collecting dots, and it's important for us to be just as good and facile with connecting those dots. And so when we see these extreme weather events, they are not just in isolation or happening in one state or happening in another part of the globe. They are all interconnected to an overall systemic issue, which is the changing climate and its impact on health. And it's important for us to articulate that. And then it's also critical for us to have the data and the tools and the systems to be able to show and share the information in a way that allows people to not just understand the data, understand the information, but to visualize it and to tell the story, which is why I really like that tribal 7 generations notion, because it really is about telling a story. It's a story of connectedness of our ancestors, and also what we're leaving behind for our future generations. And what we do today and what we do tomorrow impacts what happens for years and decades and years to come. And we want to make sure we're doing everything we can to show the data, tell the story, and ultimately the impact on people. So I think the other piece of this is really just the communications aspect and the engagement of communities, so we can ultimately all of us be together. And so if that's all, maybe rounded into a federal ask, that's what I would say is articulate it, say it, make sure we have the data systems and we invest in the technologies and the impact on people. And then the last thing is that the number one challenge that all of us have in our public health system, as well as the health ecosystem, including healthcare, is our workforce. And we have to make sure that we are investing in the workforce. They have worked tirelessly for years with the pandemic, but in addition, all the other aspects of all the other conditions that they have been dealing with, from infectious diseases to chronic health issues to environmental challenges to a whole host of everything else under the consideration of what public health does. We have to invest in the people, and we have to provide them the tools and the technologies to be able to do their job for the future that is upon us today. So those investments are so critical. It starts with the CDC, but it doesn't end with the CDC. We have to do markedly more to make sure that we're investing in our communities.
I could add a little bit to that. I completely agree with everything Umair said. I'll tell you, our experience with this current saltwater crisis that we're dealing with now, our experience with the federal administration working through this has been great. They've been incredibly responsive. President Biden signed our request for an emergency declaration the same day we sent it up. They've made their experts available. Mitch Landrieu's team from the infrastructure work has been very helpful. They really brought resources to bear and have made us feel very confident that we would mitigate this current event well. My concern is, what resources are there to help states like ours or agencies like ours plan for the future? A typical health department like mine is about 80% dependent on federal funding, and usually that federal funding has very strict guardrails. It's for a very specific program, and there's just not a lot of leeway to use that money for other uses. We've been saying this for a while, and very thankfully, over the past year, we're beginning to see funding that's a little bit more open-ended, that allows investment, that allows strategic investments in the future. We need more of that because there's no pot of money that really helps a state like mine prepare for something like this. So I think departments need continued flexibility in their funding to allow them to do the work of identifying what the threats are, studying those, communicating those, and working with partners to help make solutions for the future.
I would just like to echo the comments made by Umair and Joe, especially the piece about flexible funding. I think what you have heard here is that we have such different needs. So the threats we are facing are very different at this moment in time, and we're going to see more emergency type events. We'll need to pivot quickly. And if we don't have that flexibility, it will make it difficult to pivot. I'll also add, Umair had mentioned this piece about One Health and the fact that we are so interconnected, and we truly are. We haven't gone into a whole lot of detail about infectious disease threats, but we're very, we are at risk based on what could be happening on the other side of the globe, as we saw with COVID-19. And so not only do we need to invest in what's happening in our states and in our country, we also need to invest in what is happening globally in terms of surveillance for emerging threats, emerging infectious diseases that could be linked to climate change. Thanks.
I got a question from Karen Landman at Vox in the chat, and her question is, what are the most important things that need to happen in public health to mitigate the rising risk of vector-borne diseases, especially those spread by mosquitoes, e.g. dengue, malaria, etc.?
Anybody want to take a shot at that? Joe, you've had some experience with malaria recently. I don't know if you want to maybe start us off.
Yeah, thanks, Marcus. Not personal experience, thankfully.
No.
I think, listen, I think departments like mine do a really good job at meeting the threat of the day, and there's funding mechanisms that have been established to support that. But when things change, like we're realizing with the saltwater issue, it can be, turning the funding ship around can take a long time. And when federal resources come in, sometimes they come in strong, but it's not right away. So we've actually had, this past year for vector-borne diseases hasn't been particularly bad compared to years past, and the rainfall, in part because the rainfall has been low and there haven't been as many breeding grounds as there typically is, but that could easily change. So, I think, honestly, I'm going to come back to flexible funding, because we really do need the ability to respond quickly when facts on the ground change. And as Natasha mentioned, the realities of our states are so different, and the threats are so different, that the one size fits all funding method doesn't serve people that well. So the more that these departments are able to have funding that's flexible, I think the more they'll be able to make smart and locally informed investments.
Yeah, if I can add to that, as you may be aware, I was previously in a large community that had a lot of mosquito-borne challenges, Harris County, third largest county in the U.S. And, I will tell you that mosquito vector borne diseases are a huge area of concern, and we have to really be thinking about this in a global way. And so what happens across a jurisdictional line, we always talk about that across our state jurisdictional lines, but we really need to be thinking about global lines as well. And so even that investment in systems and health system strengthening that's happening across the globe in other countries to really beef up both their infectious disease surveillance systems and also their ability to be able to respond is such a critical piece of this. And climate plays such an important piece. And we want to make sure that we don't forget that all of these are parts of the puzzle, but the puzzle itself is climate and the changing climate and the environment. And then the last thing I would say is that there is with that mosquito vector control experience, and even what we're doing here in the state of Washington with some of our private sector companies that are here with Microsoft Research and a number of different players that are doing so much work in the global space, but they're also doing a lot of work in the innovation space. It is so important, to Joe's point about flexible funding, is it is so critical for us to have that funding and also have the ability to be able to reach out to these partners, because many of these partners have also been working to protect their own workforce in the private sector and to share their strategies, to even share some of the technology solutions and the innovation strategies that allow us in the public sector to accelerate and advance the work that we're doing, or in partnership to go at it together. I think there's a real opportunity for us to be thinking about public, private, academic, and ultimately community partnership that really comes together so we can be so successful. And what our communities absolutely want us to do is to work together for common problem solutions that are critical to the future.
Once again, I'm going to echo the things said by Joe and Umair. Again, we are in such different geographic locations and such different places in terms of our needs. So when we talk about vector-borne diseases, there's been a lot of attention paid to malaria cases in southern states. But here in Michigan, we deal with EEE, Eastern Equine Encephalitis, and we have our own unique challenges and have to be able to pivot rapidly and make sure that, number one, we have a strong surveillance system in place for these types of diseases. And number two, make sure that we have funding available for our mitigation strategies. So the need for flexible funding to meet the needs of each state is really important. And we are going to see changes in patterns. I didn't have a chance to talk about this, but Lyme disease has increased 8-fold in my state over the past decade. We were a state that had a handful of cases, and now we have Lyme disease in almost every county in my state. So we have to keep looking forward. We have to keep looking for new patterns to emerge so that we can then inform the public and take action.
And I'll just put an underline on everything that's just been said. Unlike Louisiana, we have had a banner summer for rain. And for the first time since 2015, we test mosquito pools throughout the state all summer long. We've detected EEE in several of those mosquito pools and an unfortunate horse who succumbed to the disease. Fortunately, no human cases, knock on wood, at this time, but we haven't had to worry about that condition for a while. Lyme disease is sort of endemic to Vermont at this point, but we are seeing increasing cases and northward migration of other tick-borne illnesses, including anaplasmosis and babesiosis. And in our adjoining states, a very lethal tick-borne condition, Powassan disease, has been found. So, public health can do its best at surveillance programs for both the vectors and the disease. prediction tools and early warning systems, public education, especially about personal protection measures that will only go so far. And when needed, vector control program recommendations and public policies like housing regulations and land use management strategies. But we do have to be cognizant of the fact that some of these diseases we've been mentioning, we shouldn't be seeing in the continental US at all, never mind anywhere else. And some of the vectors we shouldn't be seeing in the continental US at all. So some of those early strategies for greenhouse gas mitigation and the temperature of the planet need to be really hastened to help public health in these efforts. And I want to echo what Dr. Bagdasarian has been saying about the global nature of our surveillance. Just like it was with COVID, with all of these other diseases that are more vector-borne, we need to be very, very alert to that.
Yeah, I wanted to add one other disease that we've been monitoring, which is avian influenza, and really the changing bird migration patterns, which also has been impacted by climate, is a critical piece. And, you know, I was surprised that the state of Washington has one of the largest, if not the largest, backyard flocks when it comes to some of the poultry and livestock industry in the nation. And there has been, fortunately, no human cases, but we have been concerned about what's been happening with avian influenza across our country. And that is a real concern that all of us share, that there are these emerging infectious diseases that continue to pop up. And then when we see them, this is again the collecting of the dots, but not connecting those dots. When they pop up, we just think that they happen out of the blue, but there is a connection. And that's why we want to make sure that people are taking action now. And that's the critical message from all of us.
Thank you all. I have another question that came through the chat from Luke Zarzecki. Luke says, so Dr. Bagdasarian mentioned higher asthma visits during poor air quality. As these events occur more frequently, is there any concern for our healthcare system infrastructure?
I would say absolutely yes. I think there are some states that have more experience with this messaging, and the public is more receptive to this kind of messaging. For us in Michigan, this was a brand new type of public health messaging that we were putting out there, and folks were they were confused. They didn't know what to do. We didn't really have places to send folks who didn't, for example, have air conditioning at home. We were looking for centers with where people could go for a respite from the heat, as well as clean air. So I think that what we have to think about is not only are we seeing problems get worse in areas where those problems already existed, but we're seeing those problems creep into areas where they have never been an issue before. And that leads to a whole new type of messaging, a whole new type of surveillance structure for these problems. And that's what we faced with air quality in Michigan this past summer.
Yeah, if I could also add, during our heat dome event that was in 2021, if you remember, there were several days, if not longer, a week and a half, where we had triple-digit temperatures in the Pacific Northwest. A couple of statistics that highlight what my colleague just said is the U.S. The CDC found a 69-fold increase in emergency visits for acute heat illness in our region during the event. Now, here's what's interesting. Almost a quarter, 24% of emergency visits were for drowning or submersion during the heat dome. And many emergency visits were due to boating accidents that week that were double the weekly average during the summer months. At University of Washington, Seattle King County 911 received the most significant volume of calls since the system was launched in 1968. And University of Washington recorded that in a study that they put out there. So just adding to what Dr. Bagdasarian is saying is that there is this element to when you have something that occurs in the environment or in the community, certainly it impacts our healthcare system, and those surges in the healthcare system, obviously, if those surges are occurring when we have some other event happening, for example, a pandemic, or when you get concerned about COVID-19, RSV, and influenza, as we are during the current and upcoming respiratory season, and on top of that, you have an environmental calamity that occurs. Now you have this burden on the healthcare system that unfortunately is not sustainable. And we have to be thinking about the intersection between public health, what happens in the community and the environment, with what's happening within the healthcare system as well, because it's all interconnected.
Stephanie, if there aren't any more questions, maybe we'll go ahead and wrap things up. Okay, well, thank you. I want to thank our 4 speakers, and I want to thank all of the media for attending the event we did this afternoon. I hope one of the takeaways, sometimes the whole issue of climate change can be very controversial, and I hope after the discussion today that one of the takeaways is that, the health impacts of changes in our environment and changes in our climate, there's no controversy there. These are very real, and as you've heard from 4 of our professionals, they're becoming more and more common and more concerning. As all of you know, ASTHO is the organization that represents and supports public health leaders in our states and territories. This is an issue we're hearing a lot from them about, and that we hope to be able to represent and provide some leadership around. And we're hoping that in coming weeks and months, you'll begin to see more from ASTHO around some communications and even some potential policy implications of climate change and its impact on public health. So we'll share that as it comes forward, and be on the lookout for that. If you have any other questions after this, after we adjourn, please feel free to address those to our email address, which is media@astho.org. Again, thank you everybody for participating in the afternoon, and we really appreciate it, and look forward to seeing you again soon.